Hi everyone, welcome to my channel Eduvinate. Hope you all are doing good. Here is another very informative video regarding diabetes. In this video we will discuss what is diabetes, what are the risk factors, symptoms, how many types of diabetes are there, its pathophysiology, insulin resistance, management and much more. So let's get started. What happens in diabetes? As we all know, diabetes is a condition when blood sugar levels become too high. Glucose is the main source of energy, as we all know, and it comes from the food we eat. Under normal circumstances, our body has the tendency to convert this glucose into energy. But in diabetic condition, glucose that we obtain from the food is not converting into the energy sources, or our body cells are unable to take up the glucose from the blood. World Health Organization defines diabetes as a metabolic disease that is characterized by hyperglycemia. Hyperglycemia is sustained high levels of glucose in blood that leads to damage to other organs including eyes, kidneys, nerves, heart, etc. Let's have a look at the prevalence of diabetes. Around 422 million people globally are suffering from diabetes, and majority of the population lives in developing countries. And to no surprise, around 1.5 million deaths are directly attributed to diabetes every year. Here are the risk factors for developing diabetes. First is family history or genetics. Second is age. Elderly people are more prone to developing diabetes. Third is obesity or being overweight. Fourth is unhealthy eating habits or eating excess of junk food. Next is less physical activity, stress or anxiety, and last is high sugar intake. What are the symptoms of diabetes? Symptoms related to diabetes are increased thirst, slow healing of cuts and injuries, feeling tired and exhausted, blurred vision, frequent urination, and unexplained weight loss. Diabetes is normally characterized by 3 P's, that is polydipsia, increased thirst, polyuria, increased urination, and polyphagia, increased hunger. How many types of diabetes are there? There are basically 3 types of diabetes. Type 1 diabetes, it's an autoimmune disease. It is insulin dependent. It is characterized by complete destruction of beta cells that produce insulin. Cause of type 1 diabetes is not known. Type 2 diabetes, it is non-insulin dependent diabetes. Its main feature is insulin resistance, where insulin receptors they do not respond normally to insulin. Also, beta cells don't make sufficient insulin that is required by the body. Another type of diabetes is gestational diabetes that develops during pregnancy, maybe due to hormonal changes. Moving on to the next topic, it's diabetes pathophysiology. The main organ involved in diabetes is pancreas. Pancreas is made up of 2 types of cells, alpha cells and beta cells. Alpha cells they secrete glucagon and beta cells they secrete insulin hormone. Under normal circumstances, the release and inhibition of these 2 hormones is very well regulated. So what happens when blood glucose level rises? Beta cells of pancreas, they are sensitive to high blood sugar levels. What they do, they release insulin, and insulin release promotes the uptake of glucose in different body organs. The main organs that are insulin dependent for the uptake of glucose are skeletal muscles, liver, and adipose tissue. When insulin is released from the beta cells, it binds to tyrosine kinase receptors that are present on the cell membrane, and it triggers chain of reactions that includes coupling reactions and internalization reactions that in turn activates different pathways that leads to translocation of GLUT4 receptors on the cell membrane, and they allow the entry of glucose molecule inside the cells. Different pathways that get activated include MAP kinase signaling pathway and PI3K signaling pathway. Very important functions performed by insulin include cell growth and proliferation and gene expression. Insulin is also involved in the synthesis of lipids, proteins, and glycogen. Here it is showing how an insulin molecule binds with the alpha subunit of tyrosine kinase receptor. As binding of insulin with its receptors facilitates the entry of glucose molecules inside the body cells. So what are the effects of insulin resistance? In liver, there is increased glucose production from glycogen, there is increased gluconeogenesis, and there is increased breakdown of lipids. In muscles, again there is increased breakdown of glycogen to glucose. There is down regulation of GLUT4 receptors, so there is decreased glucose uptake and there is decreased glycogen synthesis. In adipose tissue or fat tissue, there is decreased formation of lipids, increased lipolysis, and there is increased inflammatory response. So in nutshell, we can say that there is underutilization and overproduction of glucose that is causing hyperglycemia. So what are the different diabetic complications? Sustained high levels of glucose in the blood leads to the damage to different body organs. It may cause diabetic nephropathy, diabetic neuropathy, cardiovascular complications, damage to eyes, that is diabetic retinopathy, or loss of vision in the severe cases. It might cause stroke, hypertension, onset of metabolic syndrome, obesity, skin and mouth infections, diabetic foot ulcers, amputation of limbs. Nowadays, it is also related with the development of cancers. So how do you know that you are a diabetic? There is a very important test called Hb1Ac test. It represents the average blood sugar level over the previous 100 days. Hb1Ac test is a way to assess blood glucose control over time, but it cannot replace the need to monitor your sugar levels on daily basis. American Diabetic Association has provided a chart to know where you stand in terms of diabetes. If it's between 4.5 to 5.6, then you are normal, you do not have diabetes. If it's between 5.7 to 6.4, then you are pre-diabetic, that is likely to develop diabetes. If Hb1Ac is more than 6.5%, then you are a diabetic. If it's between 6.6 to 7%, then diabetes is adequately controlled. If it's between 7 to 8%, then diabetes is inadequately controlled, and if it's more than 9%, then it's very poorly controlled. How to manage diabetes? Diabetes management includes 4 main steps. First is working out daily on a regular basis, eating healthy, eating on time and sleeping on time also, taking support of oral anti-diabetic agents, and staying happy. That is the key, because stress or anxiety are the key factors for developing diabetes. Here is the classification of oral anti-diabetic agents. First category is insulin secretagogue. It includes sulfonylureas, example gliclazide, glimepiride. Next is meglitides. It includes repaglinide, netaglinide. The main side effect of insulin secretagogue is hypoglycemia. Then is insulin sensitizers. It includes biguanides. Example of biguanide is metformin, that's the drug of choice for diabetes 2. Thiazolidinediones, that is rosiglitazone, pioglitazone. Next is incretin based therapy. It includes GLP-1 agonist. Examples are exenatide, semaglutide, liraglutide. Then DPP-4 inhibitors, vildagliptin, linagliptin. Next category is amylin analog, that is pramlintide. Glucosidase inhibitors, examples acarbose, miglitol. Now there is newer drugs, SGLT2 inhibitors, empagliflozin. Unmet needs in diabetes control. There is a lack of disease modifying agent or inability of current drugs to maintain patients' normal blood glucose level over a long period of time. There is no single therapy for chronic and progressive nature of this disease, leading patient taking multiple medications. Blood glucose regulation as normal as possible. The cardiovascular safety of type 2 diabetic agents has long been a concern because CV related deaths account for about 50% of diabetes related mortality. Regulation of energy balance, reduction of plasma triglyceride free fatty acid and thereby the risk of developing diabetic dyslipidemia, preservation regeneration of functional pancreatic beta cell mass. Here is a list of food items with low glycemic index and high glycemic index. A diabetic person should avoid high glycemic index food because it can cause instant rise in blood sugar level. So there are different fruits, vegetables, dairy products, nuts, grains given with their glycemic index. Eating healthy diet is a very important part of diabetes management. Here is the diet plan for the pre-diabetics or the diabetic people, so they can have food items that have low glycemic index in their diet plan. Eating right proportion and on right time is a very important aspect of diet management. Thank you very much for the patient listening. Hope you enjoyed the video. Please like, share and subscribe my channel, and if you have any queries you can leave them in the comment box.